benign paroxysmal positional vertigo (BPPV). Information for patients and families. Read this pamphlet to learn about what is BPPV? What are the causes? What are the symptoms and how can it affect me? How will your doctor diagnose it? What are the treatment options? BPPV is a disorder affecting the inner ear. Patients usually experience brief episodes of vertigo, that is dizziness or room spinning with changes in head position. Dizziness accounts for approximately 5.6 million clinic visits per year in the United States. 17 to 42% diagnosed as BPPV. BPPV is caused by the displacement of crystals from its correct position within the inner ear into sensitive areas. Changes in head positions can move the crystals, making your brain think you are moving, even though you are not. The most common cause of BPPV in people under age 50 is head injury. In older adults, the most common cause is degeneration of the vestibular system of the inner ear. Other causes include minor strokes, Meniere's disease, and vestibular neuritis. In approximately half of all BPPV cases, there is no cause. Symptoms include dizziness or vertigo, lightheadedness, nausea, vomiting, imbalance, abnormal eye movements, blurred vision, difficulty speaking, lowered level of consciousness. It is important to know that this is not a life-threatening condition. The duration of symptoms can be intermittent or persistent, and usually lasts from a few seconds to several minutes. Seldomly, symptoms can last from several weeks to months. Episodes are common when getting out of bed and changing positions while in bed. Symptoms go away if you keep your head in the same position or turn onto the unaffected side for a few seconds to a minute. Use caution when ambulating, specifically in older adults. Do not drive or use heavy machinery during episodes. Use caution when diving or changing altitudes. Ordinarily, your doctor can make a diagnosis based on your history and physical examination alone. Further tests may be ordered which evaluates the vestibular and auditory systems, such as the Dix-Haypike test, which involves observing the eyes with the head and body positioned in specific ways. If the results are abnormal and the findings are classic for BPPV, then additional testing is not necessary. If the results are normal or not classic, then the diagnosis of BPPV is less certain and other tests may be suggested, that is blood work, CT scans and MRIs. Other diagnostic tests include electronystagmography test, which measures abnormal eye movements induced by the Dix-Haypike test, and videonystagmography test, which measures nystagmus and target records of vestibular capacity, the vestibular visual reflex, and focal vestibular pathologies. There are a few treatment options for BPPV. Named after their inventors, the Epley and Smont maneuvers are effective treatment options, with roughly an 80% cure rate. It is intended to move the crystals out of the sensitive part of the inner ear and into a less sensitive location. Each maneuver takes about 15 minutes to complete. The Epley maneuver involves sequential movement of the head into 4 positions, staying in each position for roughly 30 seconds. The Smont maneuver involves a procedure whereby the patient is rapidly moved from lying on one side to lying on the other. Additional treatment options include do nothing and surgical management. You can do nothing and wait for it to go away. This is because symptoms are usually self-limiting and go away within 1 to 2 months of onset. As a last resort, surgical management is also indicated. Finally, Brandter-Roth exercises may be recommended when the Epley or Smont exercises fail, or when the involved side is not determined. In most individuals, complete relief from symptoms is obtained after 30 sets of exercises, or about 10 days. These exercises are performed under the guidance of your physician.